And soon, the state will have a better way for social workers to track when foster kids are relocated.
In our latest documentary, we highlighted, among other issues, the absence of a statewide IT system to do this. Now, WRAL Investigates Chris Lovingood explains some caseworkers won't have to wait long to access it.
The system won't be available to all counties when it rolls out, but the goal is to provide caseworkers with a way to understand a child's foster care history when they relocate.
Imagine a foster child moving from County A to County B and maybe even County C. Part of this new system would allow counties to more efficiently track that digitally, including the history of that child over the duration of their time in foster care. Department of Health and Human Services Director Dr. Devduta Sangvi says this is a much-needed update.
Right now, a lot of documentation occurs on paper and exists in the county. By having an electronic format, we can now avoid some of these inter-county issues that have been uncovered in some of these stories, as you outlined.
The system is called PathNC. It would also let the state gather and interpret data as it relates to the outcome of child welfare cases, and that includes foster care cases. The state is also looking at third-party agencies that vet foster parents who go on to adopt children, which was the case in the Avante Devon case, the Fayetteville mother accused of killing two of her adopted children.
We're looking at everything to understand where can we ensure that a child that's put into a foster home situation is put into a safe foster home where the threats and type of stress that they've had that actually got them into the foster system isn't replicated.
There's another system that's been in place since 2018. It's called the Child Welfare Fatality Information System, or CWFIS. The state expects that system to be connected to PathNC later this year. CWFIS is a tool to allow child welfare agencies to report children who've died and have a child welfare history. This system also gathers information on what led to the children's death. The goal for that is to find any changes that could be made to prevent more child deaths. CWFIS and PathNC are ways to have more organization in our state, which has 100 counties, providing child welfare 100 different ways with state oversight.
If it's going to require us to have more face-to-face visits across all 100 counties to create some level of standardization without losing the importance of the local connection, we're going to have to do it.
Dr. Sangvi is clear. Changes are needed.
When I hear the stories of these children, it breaks my heart. As a father, as a doctor, as a North Carolinian, you have individuals in their most fragile moment in life having that fragility made even worse because of a system that's not working for them. We absolutely need to fix it, and we are committed to fix it.
Dr. Sangvi says PathNC will start rolling out in the spring, but again, it won't roll out to every county at first. But it's a step to approaching fixing a system that lawmakers and foster care advocates say is broken. For WRAL Investigates, I'm Chris Lovingood.
So that's why our latest documentary on this was named Broken: Foster Care in North Carolina. Use your phone to scan this QR code. The documentary also explores a case in which a local mother is accused of killing two of her adopted children that Chris mentioned there. You can stream that documentary on WRAL.com.